Welcome to our video on inflammatory breast cancer. Background information. Hey everyone, so today I'll be discussing inflammatory breast cancer, also known in our wiki as IBC. This presentation will cover background information, the pathophysiology of the disease, common signs and symptoms, disease characteristics, and the prevalence. Inflammatory breast cancer is a rare but highly aggressive form of breast cancer. Unlike many other forms of breast cancer, IBC usually does not develop as just one single lump. Instead, cancer cells spread throughout the breast tissue and block lymph vessels in the skin of the breast. This blockage can cause visible swelling, redness, and inflammation. IBC is considered one of the fastest growing forms of breast cancer because symptoms often appear quickly and may resemble infection or irritation. Diagnosis can sometimes be delayed. Early detection is super important because the disease can progress rapidly. The pathophysiology of inflammatory breast cancer begins when malignant cancer cells invade and block lymphatic vessels located in the breast skin. The lymphatic system normally helps drain fluid from the tissues. When these vessels become blocked, fluid builds up, causing swelling, redness, warmth, and thickening of the skin. Inflammatory breast cancer is usually categorized as an invasive ductal carcinoma, meaning the cancer begins in the milk ducts and spreads to the surrounding tissue. Since the cancer can spread through lymph channels rather than forming a clear tumor mass, mammograms sometimes miss it in early stages. The population affected by IBC includes both men and women. Although it occurs primarily in women, research shows that it may occur more frequently in younger women compared to other breast cancers. Risk factors may include obesity, family history, hormonal influences, and genetic mutations. Some common signs and symptoms of inflammatory breast cancer can include redness covering a large portion of the breast, swelling, warmth, breast heaviness, skin thickening, and tenderness. The skin may develop a texture that resembles an orange peel known as peau d'orange. Some individuals may also experience nipple flattening, itching, enlarged lymph nodes under the arms, or rapid changes in breast size. Disease characteristics of IBC include rapid onset, aggressive progression, and early spread to nearby lymph nodes or distant organs. Symptoms often develop weeks or months rather than years. Many cases are diagnosed at stage 3 or 4 because of how quickly the disease spreads. In terms of prevalence, inflammatory breast cancer is considered rare. It accounts for approximately 1 to 5% of all breast cancer diagnoses in the United States. Even though it's uncommon, it contributes to a high percentage of breast cancer-related deaths because of its aggressive nature. Understanding the background and characteristics of inflammatory breast cancer are important for recognizing symptoms early and in help improving treatment outcomes. Benefits and contraindications.
I'm going to be talking to you guys about IDC, which is invasive ductal carcinoma, which actually is with IBC, which is inflammatory breast cancer. But I'm going to specifically be talking about the pros and cons of actually getting yourself back to 100%. So often when you go into these medical fields, you're going to actually get several treatments because unfortunately the breast cancer itself is so invasive that they're going to have to use more than one. You're going to first get chemotherapy. Chemotherapy basically is going to take the cancer area and is going to shrink it so that when you go to surgery they can actually take it out easier, and then unfortunately after you will have to go to radiation, which is going to actually kill the cancer cells itself. All benefit, they help you get better, get rid of the cancer itself so that you don't have to in your future have it for any much longer than it already is in your system. The cons to this are obviously, as everybody already kind of knows, chemotherapy and radiation and surgeries often have side effects. Chemotherapy and radiation are going to unfortunately cause a lot of hair loss. You're going to be tired. You're going to unfortunately increase your risk of infection. So you have to take really big risks when going out and doing things on your own or even with other people. So often places to limit yourself from are like, if you're going to get up and be active, because you should be getting up and being active during all of these. You don't want to sit down and honestly make it worse for yourself because you're not doing anything. Instead, we need to be getting our bodies up and going to maybe just walking around your neighborhood. Slow, nothing crazy. Making sure that you're not going to fully exert yourself to the point that like your body can't take it. So taking small steps and doing small little things is all you need. But for lowering your risk of infections, if you are going to do physical activity, don't go to a gym. If you're going to go to a gym, it needs to be a small gym. And it needs to be a gym with very small little people. Like, you can't have 200 people around you and somebody is sick and doesn't know it. Or now you're touching dirty, icky surfaces that don't get cleaned down every day. And now you're picking up germs, and that just higher your risk of infection. And unfortunately, I think I said this already, but you're going to have hair loss. And as much as that is just physically, that's going to mentally and emotionally ruin some people. And it's okay. It's okay to lose hair. I mean, as you get older, you're going to lose hair. But overall, the treatment for inflammatory breast cancer has many benefits, especially when used with several of the different treatments. At the same time, there are not often, but there are limits and there are risks to consider. At the end of the day, for myself, if I have cancer and I want to get rid of it, I'm going to do anything and everything to get rid of it so that I can live a happy, longer life, at least in the long run, so that I'm not missing anything important and I can be here with my family and friends.
Exercise prescription.
Demonstrating safe and effective exercises for people with inflammatory breast cancer. These exercises focus on improving strength, reducing fatigue, and maintaining mobility while being safe during treatment or recovery. For cardiovascular fitness, simple movements like walking or marching in place are very effective. This helps improve heart health and reduce fatigue. Start with 10 to 15 minutes and build up to 30 minutes as tolerable. Keep the intensity light. You should still be able to hold a conversation. This exercise strengthens the legs and helps with daily activities like getting up from a chair. Aim for 8 to 12 reps. Wall push-ups build upper body strength safely, especially after surgery. Keep movement slow and controlled. Dumbbell rows or resistant bands rows help strengthen the upper back and improves posture, which is important after breast cancer treatment. Stretching the chest helps reduce tightness after surgery or radiation. Hold for 15 to 20 seconds and breathe normally. Balancing exercises help prevent falls and improve stability. Hold for 10 to 20 seconds on each leg. It is important to listen to your body. Stop if you feel dizziness or extreme fatigue. Avoid high-impact exercises. Always talk to a healthcare provider before starting. To stay consistent with exercise, start small, stay on a routine, and find support. Regular physical activity can greatly improve quality of life during and after treatment. Thank you for watching.
Ways to get involved. Hey everybody, so today I get to share about how supporting the inflammatory breast cancer community is so beneficial and some ways to get involved. So, ways to get involved in supporting inflammatory breast cancer awareness. People can participate in charity walks or awareness events, like where I got this t-shirt from. I supported my grandmother in her cancer walk in November for her battle against inflammatory breast cancer. Also, you can volunteer at hospitals and other cancer organizations like chemotherapy, treatment centers, and other places like that. Sharing awareness and just educating people online is also super important. And one more way that you can support them is by donating to inflammatory breast cancer research organizations, as this disease is very rare and a lot of people don't know about it. Getting involved can help raise awareness, support patients, fund research, all for inflammatory breast cancer. So there are a couple regional centers near Columbia, and I'm going to include a map here so that you guys can see where those are. But some other places that you can see are Newberry Health Oncology and Infusion Center, Prisma Health Cancer and Institute, and South Carolina Cancer Alliance. So all these places have a lot of information about cancer and can really help patients either in their care or in their journey for rehab. So some exercise and physical activity tips are walking outdoors, gentle stretching or yoga, using some light resistance bands to build strength, or group exercise classes so you don't feel so alone. So remember to always start with low impact exercise, set small realistic goals that you guys can meet, and join support-based or group fitness programs. So I know personally, whenever my grandma started her journey with breast cancer, especially inflammatory breast cancer, I was unsure of what that all included and what was really expected of me. However, I hope that our wiki page can help educate families, support people, and just friends on how to support those going through inflammatory breast cancer. So support, movement, and community can improve your quality of life for individuals with inflammatory breast cancer. Thank you for watching. The Wiki How To. Welcome to our inflammatory breast cancer resource website. This site was created to help patients, families, caregivers, and supporters better understand inflammatory breast cancer, also known as IBC. Here you can find educational information, exercise recommendations, support resources, and ways to stay connected throughout treatment and recovery. Beginning in our wiki page, you will see names of people who are responsible for each sections of information. There's also some images so that it can help you visualize IBC better. You begin with background information. This is going to give you an overview of inflammatory breast cancer. This section explains what it is, how it develops, and how it differs from other forms of breast cancer. You'll find information about symptoms, disease characteristics, prevalence, and the aggressive nature of IBC. This section is helpful for newly diagnosed patients or family members who want to better understand the condition. Next to the benefits and contraindications, you will pull up the video Riley has made for this section. In this section, you can learn about treatment benefits and important safety considerations. The page explains how treatments like chemotherapy, surgery, radiation, hormone therapy, and targeted therapies may improve outcomes. It also discusses possible side effects and reasons why certain treatments may not be appropriate for every patient. This is Deej's video about exercise prescription. It's located right next to the title. Exercise prescription. This section focuses on physical activity recommendations for individuals with inflammatory breast cancer. You will find exercise safe guidelines designed to reduce fatigue, maintain strength, and improve quality of life. He includes cardiovascular strength, flexibility, and balance recommendations along with sample workouts and a table. Moving on, there's the video for ways to get involved. This section provides support resources and ways to stay connected. Patients and families can explore local and national support groups, cancer organizations, advocacy programs, and survivor communities. These resources help reduce isolation and provide emotional support throughout the cancer journey. At the end of each section, you'll see the sources used. All of the videos for the wiki are linked right next to the title, and all sources follow each section. Thank you for visiting our IBC website. Our goal is to provide education, support, and guidance for patients and families navigating IBC. We encourage you to support and explore the resources, stay informed, connect with support systems that can help you throughout your journey. You are not alone. Support, education, and hope are always within reach.